Blood glucose monitoring. Blood glucose meters measure blood glucose concentrations by placing a drop of blood on a test strip, which is then inserted into the meter. Portable meters provide accurate quantitative measurements, similar to laboratory tests, and store test results electronically to track glucose patterns. Inaccurate glucose results related to the patient's condition should be confirmed through conventional laboratory sampling. Timing of glucose monitoring. For patients receiving nutrition, glucose monitoring should be done before meals. Patients not receiving nutrition should be monitored every 4 to 6 hours, with more frequent monitoring as needed.
More frequent monitoring, ranging from every 30 minutes to every 2 hours, is required for a patient receiving an IV insulin infusion. Hyperglycemia is defined as a blood glucose level greater than 140 mg per deciliter, 7.8 mmol, L. Hypoglycemia, as glucose values of less than 54 mg per deciliter, 3 mmol, L.
Equipment: gloves, portable blood glucometer, alcohol pads, disinfectant pads, gauze pads, single-use auto-disabling lancet, blood glucose test strips. Optional: small, adhesive bandage, warm moist compresses, soap, water. Check the expiration date on the test strips. Before testing, turn on the glucometer. If appropriate, ensure that the code strip number on the test strip matches the code number on the glucometer. Enter your operator identification and password, if required. Enter and then confirm the patient's identification information. Perform hand hygiene and put on gloves. Confirm the patient's identity. Provide privacy. Explain the procedure to the patient. Put on gloves. Select the puncture site, usually the fingertip in adults. If feasible, have the patient wash his or her hands with soap and water, and then dry. If the patient can't wash his or her hands, clean the intended puncture site with an alcohol pad and allow it to dry completely. Alcohol may interfere with test results if not permitted to dry completely. Insert the test strip into the blood glucometer according to the manufacturer's instructions. Note that some glucometers require that you insert the test strip after applying the blood sample. To collect a sample from the fingertip, use a single-use auto-disabling lancet on the side of the patient's fingertip, perpendicular to the lines of the fingerprints. Puncture the skin.
Wipe away the first drop of blood using a gauze pad. Touch a drop of blood to the test area of the test strip. Make sure the entire test area is covered. Some glucometers require a hanging drop. Refer to the manufacturer instructions for use. Don't squeeze the patient's finger too tightly. After collecting the blood sample, apply firm pressure to the puncture site to stop the bleeding. Read the digital display on the blood glucometer when the alarm sounds. Discard the lancet in a puncture-resistant, sharp container. Remove the test strip and dispose of it properly. After bleeding has stopped, you may apply a small adhesive bandage to the puncture site, if necessary. Remove and discard your gloves and perform hand hygiene.